Greetings and warm welcome, dear audience, to our professional masterclass today. I wish you all happy weekend, and uh, we are here today with another new topic. The topic is lecture 22. Our topic is meta-analysis and systematic reviews by Dr. Ambassador Professor Dr. Rania Lampu today. And she has just told me that today she'll be doing part 1. So next week will be the part 2. So without much ado, let's get started. For this, I would like to invite Dr. Rania Lampu to start the session. Thank you.
Thank you. Thank you so much. Already 22 lectures in this series.
Yes. Wow. Wow. I told
Yes,
you, you
yes.
are a marathon presenter.
Marathon.
Yeah, I
Yes.
must give that award to you. I think
Thank you.
nobody have given you marathon presenter, right? So we will be the first one, you know?
Yes.
Great.
Thank you, and thank you very much, all the team of Elegant Empire Education for great work that you're doing, and for giving me all these great chances and opportunities to share my
Because you're
thoughts on this.
committed, Dr. Rania. You are very committed. That I really
Yes.
admire in you. Otherwise, difficult to work with me. You know,
Mhm.
you are very committed. That I admire in you, and you deserve all the good awards. You deserve a lot. You are well deserved for all the good things because you are very committed.
Thank you, thank you. So today we will dedicate our session on meta-analysis and systematic reviews. And why? Because they're both playing a crucial role. They allow us to critically evaluate existing studies, synthesize evidence, and draw reliable conclusions that can guide clinical practice, policy making, and future research. So during this session, we will explore the methodologies, the best practices, the practical applications of systematic reviews and meta-analysis, and we aim to provide not only theoretical insights, but also practical guidance to help you undertake high-quality research synthesis. So let's start. Are you able to see
Yes,
now? Yes.
yes, yes.
Okay.
It's moving.
Can you see the change of slides also?
Yes, yes,
Okay, thank
yes.
you. So first, we'll start from what is systematic review. It's a rigorous, structured method of reviewing all available evidence on a specific research question. So the goal of systematic review is to minimize bias and provide a comprehensive, transparent, and reproducible summary of the literature. So what are the key characteristics? Here, usually we have a predefined research question, which is usually framed using the population intervention comparison outcome framework or another similar framework. We have systematic search strategy. We use multiple databases and defined search terms to capture all relevant studies. Explicit inclusion-exclusion criteria, which defines actually which studies are considered and why. Critical appraisal, which assesses the quality and the risk of bias in each study, the synthesis of findings, which can be qualitative or quantitative, and the reproducibility, because here all methods are documented so others can replicate. So how this differ from a traditional narrative review in terms of purpose, systematic review answers specific question rigorously, as we mentioned. On the other hand, in a narrative or traditional review, we provide a broad overview of a topic. A systematic review is explicit, a systematic documented, the other one is usually informal. The systematic review is based on predefined criteria, the narrative one is based on author judgment. Systematic review is minimized to methodology, narrative review is higher and usually is vulnerable to author bias. Systematic review is structured, may include meta-analysis. Narrative review is mostly descriptive. And In terms of transparency, of course, the first one has a high methods. It's highly clearly reported. The other one usually has a low level of transparency. The first one is narrow and focused in terms of scope, and the other one is broad and general. So what we can say is a systematic review is like a scientific investigation of the literature with strict rules to reduce bias. On the other hand, a narrative review is more like a scholarly essay summarizing the topic based on the author's expertise and perspective. I will give you an example. Let's take an example, the effects of exercise on mental health. What we will do in a systematic review, we start, as I said before, from a research question. What is the effect of aerobic exercise on reducing symptoms of depression in adults aged 18 to 65 years old? Then we go to the search strategy. Databases, I mentioned multiple databases, PubMed or Cochrane library. We use the keywords aerobic exercise depression, then we check the conclusion criteria. We want adult participants. We will use randomized controlled trials. And we want research which is published in English from the period 2000 to 2025. That will be the process. We will review 2,000 articles. We will evaluate the study quality, the risk of bias, and finally the findings. What will be, for instance, aerobic exercise reduces depressive symptoms moderately, etc. And the outcome will be transparent, reproducible, and quantitatively supported conclusions. On the other hand, if you adopt a narrative review, the scope could be exercise and mental health, an overview, which is very, very broad to understand. What will be the approach here? That the author select studies that are relevant, may include random controlled trials, observational studies or case reports. Of course, it's not about systematic search here. The findings, for instance, exercise can improve mood or reduce anxiety, or there will be maybe discussion which include examples and expert commentary. And what is the outcome? The outcome is about a broad, descriptive and interpretative summary, but may omit some studies or be biased by author preference. So what is the key difference in this example? That a systematic review produces evidence-based, reproducible conclusions focused on a narrow question, the research question that we mentioned at the beginning, and the narrative review provides a general understanding shaped by the author's perspective without necessarily covering all relevant studies. Now, so here you can see also the table, the differences. The first one has multiple databases. The other one, here the author selects studies that they find relevant or influential. I think it's clear so far. Now, what is the difference between meta-analysis and systematic review? Meta-analysis is a statistical technique which is used to combine and analyze data from multiple dependent studies on a specific research question. So, if we pull the results, this provides more precise estimate of the effect, size, or outcome than any individual study alone. Essentially, what we could say is that it transforms qualitative findings from multiple studies into quantitative data to identify overall trends, patterns, or relationships. This is meta-analysis. On the other hand, systematic review is a methodical, comprehensive review of existing literature on a specific topic. We said before that it follows always a predefined protocol to identify, to appraise, and synthesize all relevant studies to answer a research question. Systematic reviews focus on rigor and transparency in collecting and evaluating studies to minimize bias. And what is the relationship between the two? That meta-analysis is often conducted as part of a systematic review, especially when we have quantitative data. While a systematic review can exist without a meta-analysis, if we have data which are qualitative or too heterogeneous, a meta-analysis requires systematic review to identify selected studies to include. So we could say that systematic review, it's a structural collection, evaluation of evidence, a meta-analysis, and a statistical synthesis of this evidence. So if I could give you an analogy, think of a systematic review as gathering all puzzle pieces, the studies, carefully, while a meta-analysis is putting the pieces together to see the bigger picture quantitatively. This is a great analogy to understand the relationship between the two. Now, what are the main objectives of conducting a systematic review and meta-analysis? The systematic review is transparent, is reproducible, structured. So the main objectives are first to search multiple databases and sources to include all studies meeting predefined criteria. Second, to assess study design, risk of bias, methodological rigor to evaluate reliability. Then we try to synthesize findings qualitatively. So this means that we summarize results across studies in a transparent, organized manner, highlighting patterns, inconsistencies, and knowledge gaps. Then we use pre-specified protocols to avoid selective inclusion or interpretation of studies. And finally, we can provide evidence-based guidance for clinical decisions, for policymaking, or future research directions. This has to do with informing, practicing, and policy. On the other hand, the objectives of meta-analysis. A meta-analysis, as I said before, is a statistical technique. Often, it's integrated within a systematic review to quantitatively combine results from multiple studies. So its objectives are to estimate an overall effect size. This means pool data to provide a single summary estimate. That could be a mean difference, that could be an odds ratio, with higher statistical power than individual studies. Then we measure heterogeneity to understand whether study results are similar or vary significantly. Then we explore factors, population, intervention, or study design that explain differences in outcomes. And we can reduce uncertainty around effect estimates, especially when individual studies have small sample sizes. So what is here the combined goal is that when a systematic review is paired with meta-analysis, the goal is to provide a comprehensive, unbiased, and quantitative synthesis of the evidence, guiding informed decisions in research, clinical practice, or policy making. Now, what type of research questions are best addressed by systematic reviews or meta-analysis? Both are two very, I could say, powerful tools, powerful research tools, but they are suited to specific types of research questions. So, questions about effectiveness or efficacy. For example, does cognitive or behavioral therapy reduce symptoms of depression in adults? Here, systematic reviews synthesize all high-quality studies on a treatment or intervention to provide a clear answer. Meta-analysis can quantitatively combine results to estimate the overall effect size. Another type of question about association or risk factors. Example, is smoking associated with an increased risk of lung cancer? Systematic reviews compile observational studies to identify patterns, and meta-analysis can quantify the strength of this association. Questions about diagnostic accuracy. How accurate is MRI in detecting early-stage Alzheimer's disease? Systematic reviews of diagnostic studies evaluate sensitivity, specificity, and overall diagnostic performance. Another type, questions about prevalence or incidence. For example, what is the global prevalence of anxiety disorders among adolescents? Here, systematic reviews can gather prevalence data from multiple studies, and meta-analysis can calculate pooled prevalence estimates. Questions about prognosis. For example, what is the long-term survival rate of patients after a heart transplant? So systematic reviews here aggregate studies or outcomes over time, and meta-analysis can provide pooled estimates of survival or risk. Questions where evidence is conflicting. For example, does vitamin D supplementation prevent respiratory infections? Systematic reviews and meta-analysis are particularly useful when individual studies show conflicting results, providing a clearer and evidence-based summary. So what are the key takeaways here? That best suited for questions with existing research evidence, particularly multiple studies on the same topic. It is not suitable for questions with little or no prior research, and provide both a qualitative synthesis and quantitative summary when data allow. Now, the difference between qualitative and quantitative systematic reviews in terms of definition, this is clear. First one has to do with non-numerical descriptive data, often referred to as qualitative evidence synthesis or meta-synthesis. And on the other hand, quantitative systematic review, which focuses on synthesizing numerical data, which includes meta-analysis statistically combines results. In terms of data, the nature of data, we have, of course, the first one, narratives, interviews, text. Quantitative, we have numbers. The objective for qualitative is usually explore how and why phenomena occur, understand context, meaning, or processes. On the other hand, with quantitative, we want to determine the effect size, the trends, the correlations, so we can test this way hypotheses and establish generalizable results. In terms of methodology, for qualitative systematic review, first we define the research question, which is usually exploratory. Then we identify and select relevant qualitative studies. Then we extract themes, concepts, or patterns. And finally, we summarize these findings using methods like thematic synthesis, meta-ethnography, or framework synthesis. On the other hand, for quantitative systematic review, what is the process here? The methodology. We define the research question. Here it's not exploratory, it's often effect-based. We identify, we select relevant quantitative studies, we extract numerical outcomes and study characteristics, and finally we synthesize findings using statistical methods, often performing meta-analysis. So what's the outcome, the results? That qualitative has to do with narrative, summary of themes. Quantitative has pooled estimates. What are the strengths and limitations here? Qualitative has to do with deep understanding. Quantitative is flexible, quantitative is objective, measurable, etc. So qualitative systematic reviews answer how and why questions. On the other hand, quantitative systematic review answers how much or how effective questions. Now, why a protocol registration, for instance, Prospero, is important for systematic reviews? This is actually a critical step in conducting systematic reviews because it enhances transparency, credibility, and methodological rigor. And why it is important? Because it prevents duplication. It registers the review in a publicly accessible database. It helps also researchers see ongoing reviews and avoid unnecessary duplication of effort. Second, reduces risk of bias because pre-specifying objectives or inclusion criteria or methods, this prevents selective reporting of outcomes. It minimizes also a temptation to change the scope based on the results found. Then it increases transparency because it makes the review process open and accountable to the research community. Readers and reviewers can compare the final review to the initial plan to detect deviations. It enhances force credibility because journals increasingly prefer or require protocol registration before publication. And registered protocols signal rigorous planning and methodological integrity, boosting trust in the findings. And finally, it facilitates planning and collaboration. Why? Because it helps researchers organize search strategies, data extraction, and analysis methods systematically. It encourages collaboration by allowing other researchers to see and possibly contribute to ongoing reviews. The bottom line is that protocol registration ensures that a systematic review is planned, is transparent, is reproducible and trustworthy, which actually strengthens both the research process and the validity of its conclusion. Now, about methodology. So here we want to see step-by-step guide to conducting a systematic review. We will start by defining the research question. How we will do this? By formulating a clear, focused question using frameworks like the PICO that I mentioned before. What is the PICO framework? This acronym stands for Population, Intervention, Comparison, Outcome. This is for clinical studies. Example, does intervention reduce blood pressure in adults compared to placebo? Then we develop a protocol. We register the protocol. For example, I mentioned before about the Prospero protocol in order to specify objectives and rationale. So we have the objectives, we have there the inclusion-exclusion criteria, we have the search strategy, then the data extraction methods, the risk of bias assessment, and this, of course, helps ensure transparency and reduces bias. After we conduct a comprehensive literature search, we search multiple databases. We include grey literature. We have explained in previous sessions what is grey literature. This includes conferences, proceedings, or theses, or some policy papers in order to minimize publication bias. We document the search strategy, keywords or filters used, and then we screen and we select studies. First, we have the title and the abstract screening, so we remove clearly relevant studies. After there is a full text screening, so we assess remaining studies against inclusion or exclusion criteria, and screen and select this stage is usually performed by 2 independent reviewers in order to reduce selection bias. In order to extract data, here we use a standardized form to collect study characteristics or population details or interventions and comparisons, outcomes, and results. And this ensures consistency by having 2 reviewers extract independently. After we assess the risk of bias, how we evaluate methodological quality using tools appropriate to study design. That would be random controlled trials, Cochrane risk of bias tool, for example, or observational studies like a Newcastle-Ottawa scale. And this, of course, helps interpret findings considering potential bias. Then we synthesize the evidence. So for qualitative synthesis, we summarize patterns, trends, and inconsistencies across studies. For quantitative synthesis, which is the meta-analysis here, we pull the numerical data to estimate overall effect sizes if studies are sufficiently homogeneous. After we analyze heterogeneity sensitivity, so we check variability between study results, we conduct subgroup analysis or sensitivity analysis to explore sources of heterogeneity. And finally, we report findings. We follow reporting guidelines like PRISMA. I'm going to see what is PRISMA. It's the acronym of which stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis. And these report findings include the flow diagram of study selection. There are tables of study characteristics. There is a summary of findings and effect sizes, and of course, all the limitations and recommendations. And then we interpret and we conclude by discussing results in context of existing literature. We highlight strengths, limitations, and implications for practice of further research. Now, I mentioned about inclusion and exclusion criteria. Inclusion criteria, systematic reviews. First, of course, for inclusion criteria, the first would be population, so specific groups that must be present for a study to include in the review, specific group of participants, that could be adults, for instance, with type 2 diabetes. The intervention is a treatment program of factor being studied, the comparison, what intervention is compared against placebo or standard care, the outcomes, the results of interest, the study design, type of studies considered, the time frame, language, publication years, or languages of eligible studies. The exclusion criteria. These specify which studies are not eligible for the review, often the inverse of inclusion criteria. So some examples, studies on populations outside the focus, studies without relevant outcomes, or no peer-reviewed sources, or low-quality studies, duplicate publications or studies with incomplete data. And why they are important? Because of this inclusion criteria, because this helps the review answer a specific, well-defined research question, because this reduces bias, prevents the selective inclusion of studies that could alter results. This increases reproducibility, so other research can follow the same criteria and replicate the review. It enhances transparency because readers can clearly see why certain studies are included or excluded, and improves the quality of evidence. By excluding low quality or irrelevant studies, the conclusions are more reliable. So more or less, we explained the inclusion criteria. The exclusion criteria, studies on population outside the focus, or studies without relevant outcomes, not peer-reviewed, and applicate publications. So explain now the process of filter to search and study selection systematic reviews. The literature search is a systematic, comprehensive, and reproducible process to identify all relevant studies. So what are the steps? First, we define the research question. We use the frameworks I mentioned before, PICO framework for quantitative reviews, or the other one, which is called Population Phenomenon of Interest or Context framework for qualitative reviews. Then we develop a search strategy. We identify keywords or synonyms, control vocabulary. Then we combine search terms like Boolean operators, what are the Boolean operators, and or not, etc. And after we select the databases and sources, common databases, PubMed, Scopus, Web of Science, etc. We include also grey literature, I mentioned before, and we conduct a search, apply the strategy across selected database. We record the number of hits, maybe the data search, the search strings for reproducibility. And finally, we manage references. So we use reference management software. The three popular ones are EndNote, Mendeley, Zotero, to organize studies and remove duplicates. For study selection, after identifying potential studies, the next step is to screen and select studies based on predefined inclusion and exclusion criteria. For instance, we define the inclusion criteria would be study design, population, language, publication, data, outcomes, relevance. Exclusion criteria, irrelevant topic, or poor quality or no peer-reviewed sources. Then we screen titles and abstracts. 2 or more reviewers independently screen for relevance. Disagreements are resolved through discussion or a third reviewer. The full text screening, this retrieve full text of potentially eligible studies. Then we assess each study against the inclusion-exclusion criteria. Then we document the process. So we use the Prisma flow diagram to report the number of studies, identified, screened, excluded, and included. And of course, we try to maintain transparency and reproducibility. The final study selection, it's only studies that meet all criteria that would be included in the systematic review for data extraction and synthesis. What are the key points? That the process must be transparent, reproducible, and unbiased. Multiple reviewers reduce selection bias, and comprehensive documentation ensures the review can be replicated. The Prisma flow diagram, what is this? I mentioned before, is a visual tool which is used in systematic reviews and meta-analysis to show the process of identifying, screening, and selecting studies for inclusion. So PRISMA stands for Preferred Reporting Items for Systematic Reviews and Meta-Analysis, which is an evidence-based set of guidelines aimed at improving transparency and reproducibility. What is the purpose of the PRISMA flow diagram? It illustrates the study selection process from the initial search to the final studies. It ensures transparency so that readers can see how many studies were considered and why some of them were excluded. And it enhances reproducibility because this allows other researchers to replicate the search and selection process. What is the PRISMA flow diagram I mentioned before? The first point is this, the purpose, and the second one, the typical components. Then the identification, so for example, the number of records identified through database searches and other sources, that would be references or manual searches. The screening, number of records after duplicates are removed, or number of records screened based on titles and abstracts, number of records excluded at this stage. The eligibility, full text articles assessed for eligibility, or number of full text articles excluded and reasons for exclusion, for example, wrong population or wrong outcome. And included number of studies included in the qualitative synthesis, systematic review, or number of studies included in the quantitative synthesis, meta-analysis if applicable. How data is data extracted and managed in systematic reviews. Before saying this, I want to say here that why this is important, the PRISMA, because obviously it provides a visual summary of the study selection process. It helps readers assess the rigor of the review. It shows the transparency of inclusion-exclusion decisions. It is often required by journals for systematic review submissions. Now, how is data extracted and managed? First, we can create a standardized template to collect relevant information from each study. So typical fields include study identification, author, journal, the study design and setting, participant characteristics, intervention and comparison details, the outcomes measured and results, and funding sources, also conflicts of interest. Forms can be paper-based or spreadsheet-based or using systematic review software. Then we train the reviewers. 2 reviewers are usually trained to extract data consistently. We pilot the form on a few studies to ensure clarity and completeness, and then we extract data independently. We have, for example, data dual extraction. What is dual extraction? When each study is independently extracted by 2 reviewers to reduce errors. And the second type is what we call discrepancy resolution, when differences are resolved through discussion or a third reviewer. Then we manage extracted data. How we manage? We can organize data in tables or databases for easy comparison and analysis. We keep raw data intact and document any transformations, for example, converting units or calculating effect sizes. We use version control to track changes during extraction and synthesis. Then we try to handle missing or unclear data, so contact the study authors for clarification if necessary, or we can record the assumptions made to deal with missing data for transparency. After we have quality checks, we periodically verify a random sample of extracted data against the original studies to catch errors, and we document all checks to maintain auditability and producibility. Finally, we prepare data for synthesis. We organize extracted data for qualitative synthesis, so we summarize study characteristics and outcomes. And qualitative synthesis, we convert outcomes into consistent formats and compute effect sizes. So the bottom line here is that systematic review data extraction is structured, is double-checked, well-documented, ensuring that the final synthesis is reliable, reproducible, and transparent. Now, we want to discuss the methods used to assess study quality and the risk of bias in included studies. How to assess study quality? Here we have the Cochrane risk of bias tool for randomized control trials. This actually tool evaluates bias in domains like randomization or deviations from intended intervention or missing data or outcome measurement and reporting. Then we have another tool which is called Robbins. It's risk of bias in non-randomized studies of interventions. This is for observational studies focusing on confounding, selection, classification, or measurement bias. After we have another tool, Newcastle-Ottawa scale for cohort and case control studies. This assesses selection, comparability, and outcome exposure. AMSTAR2 for evaluating the quality of systematic reviews. After we have also the quality rating, because studies can be classified as high or moderate or low quality based on criteria like study design, sample size, control of confounding, clarity of reporting. Then we assess the risk of bias. We have risk of bias, which refers to systematic errors that could distort the results. So key methods could include a domain-based assessment, how to evaluate specific domains depending on study type. For example, the random control trial, we have bias arising from the randomization process or due to missing data, bias in measurement of the outcome, etc. Then we have observational studies on the Robbins side domains, and this includes confounding or classification, performance, detection, reporting bias. Then through visual tools, so there's a risk of bias graphs and summary tables, which provide a visual representation of bias across included studies. And this, of course, helps researchers quickly see which studies may have limitations. And the sensitivity analysis, which assess how including or excluding lower quality or higher risk studies affects overall results, providing confidence in findings. What is the importance of this method? That actually this ensures that results and conclusions are trustworthy. This helps helps interpret variability across studies, supports evidence grading. That is great. We're going to see what is this, which actually considers risk of bias when rating the certainty of evidence, and this guides recommendations for future research by identifying methodological weaknesses. Heterogeneity in meta-analysis and how heterogeneity is measured. Before this, I want to say that, in short, we could say that study quality tools focus on methodological rigor, while a risk of bias assessments identify systematic errors that could distort our findings. Both of them, study quality test and the risk of bias assessment, are essential for a credible, high-quality systematic review or meta-analysis. Now, in meta-analysis, heterogeneity refers to the variability or differences in study results included in a review. So it happens when studies do not estimate the same underlying effect due to differences in population characteristics or interventions or outcomes measured, differences in study design. And why it matters? Because high heterogeneity may reduce confidence in pooled estimates. Okay, and it can suggest that combining results may be inappropriate without further exploration. This is a definition of heterogeneity in meta-analysis. The types of heterogeneity, we can have clinical, when there are differences in participants' interventions or outcomes, or we can have methodological heterogeneity, differences in study design, quality, or risk of bias, or statistical heterogeneity when we have variation in effect sizes that exceeds what would be expected by chance. Measuring heterogeneity, we have first T-square Cochrane's test, which tests whether observed differences in results are compatible with chance. The interpretation with the p-value here. And the limitation is that it is sensitive to number of studies and that may be underpowered with few studies or overpowered with many studies. We have the I statistic, which represents the percentage of total variation across studies that is due to heterogeneity rather than chance. And then we have the final one, the TOE, which estimates the between study variance in random effects meta-analysis and is used in weighting studies when we want to combine results. So how we can address this heterogeneity? We need to explore heterogeneity by population, by intervention type, or study quality. So subgroup analysis. Second, meta-regression. What is this? When we want to examine the effect of study level characteristics on outcomes. Then the random effect model. This accounts for variability across studies rather than assuming a single common effect, what we call fixed effect model. And sensitivity analysis, when we want to test robustness of results by excluding outliers or low quality studies. So heterogeneity reflects actually differences between studies. The I statistic I mentioned before is the most widely used to measure, showing the proportion of variability due to true differences rather than chance, and guiding the choice of meta-analytic models and interpretation of pooled results. And I mentioned before about fixed effect and random effect models. So how we can explain these models in meta-analysis? Fixed effect model. This model assumes that all included studies estimate the same true effect size. So differences between study results are attributed only to sampling error, random variation, not to real differences between studies. And the key characteristics, it is best for homogeneous studies with similar populations, weight studies based on inverse of their variance. Confidence intervals are usually lower in error here because variability between studies is ignored. And the pooled effect represents the common true effect across all studies. If heterogeneity is present but ignored, estimates may be misleading. This is the fixed effect model. And on the other hand, we have the random effect model, which assumes that the true effect size varies across studies due to differences in populations. We have observed differences which reflect both sampling error and true between study heterogeneity. And what are the characteristics? It's more appropriate for heterogeneous studies. The previous one, we said it's best for homogeneous studies. Here, it incorporates an additional between study various component. It gives relatively more balanced weights. Because smaller studies contribute more than in one fixed events. And confidence intervals are wider here, reflecting uncertainty from heterogeneity. So what is interpretation? That the pool effect represents the average effect across studies, accounting for variability, and better reflects real-world variability in interventions or populations. The interpretation of the values, heterogeneity level, here we can see how this works. Here we can see, for instance, another topic has to do with publication bias before concluding. What is the publication bias and how it can be detected? Publication bias actually happen when the published studies are systematically unrepresentative of all studies conducted. Studies with statistically significant or positive or interesting results are more likely to be published. Studies with null or negative findings are less likely to appear in journals, and this bias can distort the results of systematic reviews or meta-analysis because it can lead to overestimation of effect sizes. What are the causes of this? First is editorial bias, and it is clear the author bias. The language bias, which happens when only studies published in certain language are included, and it may, for example, exclude relevant studies, altering results. We have the citation bias, and studies are more likely to be cited and retrieved due to reputation or visibility. It can affect which studies are included in the review. The time lag bias, so positive results may be published faster than negative results. Of course, the reporting bias, because selective reporting of outcomes within studies, this can misrepresent the true effect. the data extraction also, the data extraction and analysis bias results, which actually has to do with errors or inconsistencies in data extraction or coding. If, for example, we use inappropriate statistical models, this can introduce bias. The conflicts of interest or funding bias, because industry-sponsored studies or reviewers with financial or professional conflicts may influence inclusion, interpretation, or conclusions. Reviewers' bias, reviewers' preconceptions or expectations may affect study selection, quality assessment, or synthesis. And outcome reporting bias in the review if reviewers emphasize certain outcomes over others or they deviate from the registered protocol, this can introduce bias. The bottom line is that even systematic reviews are not immune to bias. So key safeguards, the key safeguards have to do with comprehensive and biased searches, the pre-registered protocols, the dually dependent screening, transparent reporting, the critical assessment of study quality, etc. All this publication bias, which actually happen when the publication studies are systematically unrepresentative of all studies conducted. Studies with statistically significant or positive or interesting results are more likely to be published, definitely. Studies with null or negative findings are less likely to appear in journals, and this bias can distort the results of systematic reviews and meta-analysis, leading to overestimation of effect sizes. So some journals can favor positive novel results, editorial bias, the author bias sometimes because researchers may not submit negative or inconclusive studies, the time lag bias, positive results are published faster than null finding. All these issues are very important to consider, and we want to detect the publication bias. We have some ways. First, we have the funnel plots. It's a scatter plot of study effect sizes against a measure of precision. And here, how we can interpret this as symmetrical funnel, little or no publication bias, or asymmetrical funnel, possible publication bias with missing studies. And it's often used as a visual diagnostic tool. Or we can use statistical tests for funnel plot asymmetry, Eagers regression test, which detects asymmetry by regressing standard normal deviate of effect size and precision, Beck's rank correlation test, other methods, stream and fill method, which estimates and adjusts for missing studies to assess impact or pooled effect. With the literature that I mentioned before, and sensitivity analysis, checking how inclusion or exclusion of smaller or unpublished studies affect results. What are the implications of this publication bias? That this can lead to overestimation of treatment effect or associations that may affect clinical policy decisions based on meta-analytic results, and that highlighting and addressing publication bias is something that improves the credibility and reliability of systematic reviews. So, what criteria could you use to assess, to critically appraise a systematic review? Critically appraising a systematic review involves assessing its rigor, its transparency, and reliability. So the main criteria are this one: is the research question clearly defined? Using PICO, for example, framework I mentioned before, the population, intervention, comparison, and outcome framework. Are the objectives specific and focused? For protocol, was a protocol registered? I mentioned the Prospero protocol before the review began. Does the review follow pre-specified methods, reducing risk of bias? Is the literature search comprehensive, covering multiple databases and great literature? Are the search engines documented, including keywords, filters, and dates? Are language restrictions justified? For study selection, are inclusion and exclusion criteria clearly defined? Was a study selection performed by at least 2 independent reviewers to minimize bias? For data extraction, was a standardized extraction form used? Was data extraction performed independently by 2 reviewers? Are methods for handling missing or unclear data described? For quality assessment, are included studies assessed for methodological quality using appropriate tools, or are the results interpreted in light of study quality? For data synthesis, are synthesis methods clearly described? If meta-analysis was performed, was heterogeneity in meta-analysis assessed? How? Through T-squared, through I2? Was the model choice fixed or random effect justified? If only qualitative synthesis, then we will ask if our patterns, trends, or consistencies clearly reported. For results and reporting, are study characteristics summarized in tables? Are outcomes presented clearly systematically? Are limitations of included studies in the review acknowledged? For transparency, conflicts of interest, are funding sources and potential conflicts of interest disclosed? Are deviations from protocol or post-hoc decisions explained? Entity applicability and relevance, and if our conclusions are supported by evidence and applicable to the intended population or context? Are the implications for practice, policy, or research discussed? So a high-quality systematic review is transparent, is reproducible, is methodologically sound, and critically reflective. Using structure appraisal tools like AMSTAR2 or Robbins, this can help us systematically evaluate this criteria. For meta-analysis, how we can evaluate the validity of meta-analysis? This involves assessing both the methodological quality of the meta-analysis itself and the quality of the included studies. How the meta-analysis should have a clearly defined research question. Inclusion-exclusion criteria should be explicit, appropriate, and consistently applied, so we search for relevance. A comprehensiveness check if the search included multiple database, great literature, and non-English studies to avoid selection bias. Then we assess the quality of included studies. If the overall validity depends on the quality of the primary studies, where randomized controlled trials or high-quality observational studies included, where studies at high risk of bias were included, did the meta-analysis assess risk of bias using tools Cochrane, ROB2, or Newcastle-Ottawa scale? What was used? They will examine the statistical methods, the effect size calculation. Are effect sizes calculated appropriately for continuous, dichotomous, or correlational outcomes? The weighting, check if studies are weighted correctly, typically using inverse variance weighting. The model choice was a fixed effect or random effects model used appropriately based on heterogeneity. Heterogeneity assessment. Also, look for I2 statistics or Cochrane test to measure variability across studies, or sensitivity analysis. Did the authors check whether results change when lower quality or risk high studies are excluded? Then we assess for publication bias. Meta-analysis can be altered if negative or null results are underreported. So common methods is use funnel plots to visually inspect asymmetry, or Eggers test or Beck's test for statistical evaluation. For transparency and reporting, check if the meta-analysis follows the PRISMA guidelines that I mentioned, including flow diagram of study selection. It includes detailed methods also, data extraction procedures, a clear reporting of pooled results and confidence intervals. Finally, we evaluate the consistency interpretation. So what about consistency? Are results consistent across studies, or is heterogeneity too high? The applicability, are the populations, interventions, or outcomes relevant to your context? And conclusions, do the conclusions match the data without overgeneralizing beyond the evidence? And what is the key takeaway here is that a valid meta-analysis is based on a clearly defined question, includes high-quality relevant studies, it uses appropriate statistical methods, it assesses heterogeneity, publication bias, and transparently reports methods and findings. So common limitations for systematic reviews and meta-analysis. Limitations are usually related to the included studies. When the review, for example, is only as reliable as the included studies, or have low quality bias studies which can distort or pull the results, or differences in study populations, interventions, methodologies may make it difficult to combine results meaningfully when you have a complete reporting, etc. Methodological limitations, mentioned about all these categories of bias before. The statistical limitations, smaller, for example, studies may disproportionately influence the pooled estimate if it's not properly weighted. The over-reliance on aggregate data, summary statistics may mask variability or nuances in individual patient data, and high heterogeneity can reduce confidence in pooled estimates. Other statistical limitations of generalizability, if findings may not apply to all populations, if included studies are geographically or culturally or demographically limited, or results may reflect specific interventions or settings, the time and resource constraints, other ethical and reported limitations, for example, lack of transparency, insert strategies or exclusion decisions can reduce reproducibility, or conflicts of interest in included studies may introduce hidden bias, etc. So all these limitations for both, and I will stop here because it's already 1 hour, I think.
Yes. Quite a long session. Very fast. Yeah, very fast. Thank you so much, Dr. Rania, for this brilliant session. And as usual, as wonderful as usual, and very interesting. And today, dear audience, we had covered meta-analysis part 1, and next week we'll be doing part 2 again on Saturday. Yeah. So I hope you have gained much from this sharing, and definitely, you are privileged, to join this class because you are getting it free over our YouTube. So we are all very thankful to Dr. Rania for her sharing. Thank you so much, and thank you so much, Dr. Rania, for your for being so generous in attending and so committed in getting your session done weekly. Yeah, I know you are very busy. You have your personal life, but still you are dedicated to serve the people. Thank you so much, and we'll meet again next Saturday with another professional class, and on Wednesday, as usual, SDG Forum. Yeah, thank you so much.
Thank you.